Rahim. In the name of Allah, the most gracious, the most merciful. Thank you very much, Dr. Maheen, for such a kind introduction for myself. Today we are going to talk about different segments regarding the role of lifestyle interventions in managing gestational diabetes mellitus. Now, we are here from PKNC and we are going to talk about the non-pharmacological treatment, how we can treat the patient who is suffering from gestational diabetes mellitus, and by using no medicine at all, how we can manage this gestational diabetes. Gestational diabetes is a form of diabetes that develops during pregnancy and typically resolves after childbirth. It is characterized by insulin resistance and elevated blood glucose level. This is just a general definition you all know very well. And euglycemia, which is the normal level of blood glucose, can be achieved with non-pharmacological treatment among 70 to 85% of women with gestational diabetes mellitus. This is very important, that the key take-home message today is that 70 to 85% of the females suffering from this disease can be cured even without using any medicine. Now, the aim is actually that the fasting blood glucose level should less than 92 or equal to 92 milligram per deciliter. Now, risk factors: who are the females who are at risk of development of gestational diabetes mellitus, especially who are overweight, having BMI more than 25, having age more than 35 years of age, family history of diabetes, either mother or father, they are diabetics, and the ethnicity. Now, here comes the I must say the triad of role of healthcare team in supporting the lifestyle. First is the multidisciplinary approach. Today is the time of merger, the time of collaboration, the time of fusion. The dietitians, the doctors, the pharmacists, they should all make amalgam when we are going to treat any of the disease. Same is the case here in gestational diabetes mellitus. See that what is seen in this multidisciplinary approach is that all ops people, nutritionists, exercise specialists, and diabetes educationists, they all, along with the patient, educating patients on dietary and lifestyle changes leads to better adherence and outcomes, and frequent monitoring of the maternal and fetal outcome. The goal is that healthy mother and healthy baby after delivery. Just a brief review of the pathophysiology of gestational diabetes mellitus. Either there is insulin resistance or impaired insulin secretion, pregnancy-related hormonal changes, for example, placental hormones, then impaired insulin secretions, beta cell dysfunction results in reduced insulin secretion, leading to elevated glucose levels, and the effect is that the fasting blood glucose is more than 92 milligram per deciliter, or the postprandial blood glucose is more than 180 milligram per deciliter. Now, importance of lifestyle is, the first is the evidence. The lifestyle intervention can reduce incidence by 30 to 60%. The prevention, lifestyle changes prevent the progression to type 2 diabetes in up to 70% of women with a history of gestational diabetes mellitus. Because most of the time what we see that when a female develops diabetes during the course of her pregnancy time, it is seen frequently that much earlier, later on, she is going to develop type 2 diabetes mellitus. But if lifestyle modification is there, she is not going to develop it. And with lifestyle modification, we can prevent this disease, which is mother of all diseases. The fetal outcomes, they are also, with lifestyle modification, we can reduce the risk of macrosomia, preterm birth and neonatal hypoglycemia. Now, when we are talking about the lifestyle interventions, every time and again, wherever we go, people, they are in habit of talking, ji, lifestyle change kare, lifestyle change kare. So what is this lifestyle changing? इसके लिए तो ये तो नहीं है कि कोई बहुत हाई फाई स्टफ हमें चाहिए, कोई बहुत हाई फाई चीज़ें चाहिए. What we need to do is just we need to discipline ourselves. Then how we can do it is, the first one is dietary modifications. Just 30 to 50% 30-50% reduction in risk with GDM is seen with proper nutrition. And with proper physical activity, like regular moderate exercise, just routine normal paced walk, 30 minutes a day, 5 times a week is enough. And this walk should be a proper walk. It should not be that you are doing your daily chores and you are considering that a walk. Next is the weight management. Aiming for a controlled weight gain can reduce the risk of GDM by 40 to 50%. Now, what is this concept of controlled weight gain? The controlled weight gain is that in first trimester, this much kilogram should be increased. It should not be like, ji, pregnancy is there, तो जी साथ ही देसी घी शुरू हो जाए, साथ ही इतना stuff शुरू हो जाए कि हम start में ही बहुत ज़्यादा weight gain कर लें. It is not needed at that time. Then stress management. Stress reduction techniques, they help to lower the cortisol levels, improving glucose regulation. And regular monitoring, continuous glucose monitoring improves glycemic control and reduces adverse pregnancy outcomes. Now, role of carbohydrate intake. Now, low glycemic index, that is very important. Low glycemic index, actually, the foods which are rich in low glycemic index, they keep you full for longer time, and they are not responsible for making your blood glucose level very high. Example is whole grains, legumes, and non-starchy vegetables. Avoid high glycemic index foods like refined sugars and white bread. Evidence C25 reduction with this, and dietary patterns, the Mediterranean diet. Now, Mediterranean diet, when we are talking about, is actually a type of diet which coastal people, they are using it. And that diet is rich in different type of oils, especially coconut oil, olive oil, along with that of vegetables, fresh foods, and fruits. And in meat, they are using fish, and very less amount of carbohydrate they are taking. So the diet which is rich in fruits, vegetables, whole grains, healthy fats has been shown to improve insulin sensitivity. And this Mediterranean diet is very close to what especially the females they are doing nowadays, जिसको हम keto diet भी कहते हैं. This is not exactly the keto one, but close to it, जो roughly घरों में की जाती है, कि very less amount of carbs and more amount of proteins in it. Now, recommended diet plan for gestational diabetes mellitus. See, the concept of one plate is here. Now, this full plate along with one portion of dairy, this is recommended for gestational diabetes mellitus. Now, if we do 4 quarters, the carbs should fill 40 to 50% of total calories. proteins 20 to 25%, fats 25 to 30, fiber same, so much amount 25 to 35%, and very important to keep you full, and it improves the glucose control and insulin sensitivity. And the meal timing is small, frequent, 3 meal plus 2 to 3 snacks to prevent blood glucose. If you see the 4 quarters, more than a quarter is actually part of vegetables, lesser than a quarter is fruits, more than a quarter on one side they are grains, lesser than a quarter are proteins. Now guide to portion size over here. The fingertip is equal to 1 teaspoon and 1 thumb is equal to 2 tablespoons. The fist is equal to 1 cup serving, and the center of the palm is equal to amount of protein you should be taking, and the fist is equal to half cup. So this is how you are going to tell your patient that how you are going to take your meals in amounts. And if you want to help a patient, then you can make a customized diet plan for her according to her socioeconomic status as well. It should be palatable, easy and doable one. It should not be very fancy कि वो कोई उसको use ही ना कर सके. The diet plan must be customized after detailed sitting with the patient, uski liking, disliking, uska socio-economic status, uska ethnic group, uski cultural norms, uske tastes, uski likings, each and everything. Consider her lifestyle, daily workout, job, dietary habits, pattern of eating, requirements, preference, affordability, culture, convenience, the safety of mother and fetus, which is the ultimate goal. Flexibility in meal options should be provided to the patient to increase compliance. Rectify, modify diet and lifestyle which are injurious to the health of mother and fetus. Check and reinforce her diet plan on follow-up visits and address any concerns. Now the physical activity, as you can see the different references, it is recommended that at least 150 minutes of moderate intensity of aerobic exercise per week is recommended for pregnant female. Evidence is that exercise reduces fasting glucose by up to 20%. And all the physiology people, you all know that actually what happens is that there is increased permeability for glucose, and the more and more glucose from the blood is going to enter the cells. So that is going to be stored for your activity and not it is going to stray there in the blood. And the benefits are that it improves glucose uptake in muscle cells, it lowers maternal weight gain, reduces the risk of preeclampsia. Now, safety considerations in exercise we should be taking care of. और ये जो है कि एक misnorm है, misconception है, we should all taking care of this too, as we are taking care of maternal health. KG physiology should be pregnancy should be taken as a physiology. It is not a pathology. जो हम ऐसे कह रहे हैं जी she is a pregnant female, उसको ज़्यादा नहीं चलना फिरना, उसको केयर करनी है, तो ये है उसके लिए recommendation that she should be taking moderate sort of exercise as well. Now BMI and risk. Obese women who have the BMI more than 30, they are at 2 to 4 times higher risk of development of gestational diabetes mellitus. And the ideal weight gain for underweight females, it should be around 20 to 40 pounds during the course of her pregnancy. For normal weight, 25 to 35 pounds. For overweight, just 15 to 25 pounds, and for obese, 11 to 20 pounds only. And the gradual weight gain through balanced diet and exercise reduces the risk of gestational diabetes mellitus. Stress management, very important, because stress is one of the causes of increased appetite as well. Elevated cortisol levels can worsen insulin resistance and blood glucose control. Some breathing exercises, relaxation techniques, they're all available over there on net. Importance of monitoring of blood glucose. The targets are that the blood glucose should be less than 95 milligram per deciliter. Continuous glucose monitoring is very important. And this monitoring actually prevents the adverse outcomes such as preterm labor and fetal macrosomia. Behavioral change strategies. Motivational interviewing. It helps patients to set personalized goals and overcome barriers to change. Whenever we want to change anything, we need to motivate people. We need to create the dil ki awaaz. If there is a dil ki awaaz, so the females, they are going to do comply. And the SMART goals should be there. The SMART, the S stands for specific, M for measurable, A for achievable, R for relevance, and time bound. The goals should be SMART ones. And the follow-ups, they are very important. Every antenatal visit, 2 is quite early, 4 weekly antenatal visit पर ये सब कुछ सारा कुछ revise होना चाहिए to prevent it. Evidence supporting lifestyle interventions. Lifestyle intervention reduces the risk. The lifestyle modification reduces the risk of type 2 later on, and to develop it, and potential changes in implementing lifestyle changes. Adherence of treatment issues. Socioeconomic barriers, the cultural barriers, dietary preferences, the cultural beliefs, they are all. Then personalized जो challenges हैं उनमें personalization, tailored nutrition is important for every female if possible. Community resources should be channelized at different levels. Collaborating with local resources, behavioral support is quite important. And role of technology in supporting lifestyle modification, different apps like MyFitnessPal, Glucose Buddy, remote monitoring, that is there. Online communities are there. And long-term benefits, they are very important. And thank you very much, all of you from my side. And now for much detailed and dissected review about this, Dr. Masood Bhatt is inshallah. Thank you.
एक अनाउंसमेंट थी कि पोस्टर प्रेजेंटेशन इंशाल्लाह